This just in our health lead, the Deputy Secretary of the Department of Health and Human Services, Jim O'Neill, is expected to serve as the acting director of the U.S. Centers for Disease Control and Prevention, or CDC, according to an administration official and another person familiar with the matter. This is the big question being asked today by top scientists and doctors. Are the actions of the Secretary of the Department of Health and Human Services actually actively making you and your family less healthy? Robert F. Kennedy Jr., who has no scientific degree and has no medical degree, and who for decades has been pushing medical and scientific falsehoods, is today wreaking havoc at the CDC. The former CDC director, Susan Manaras, was fired after less than 1 month on the job. A person familiar with the situation told CNN that Manaras and Secretary Kennedy quickly ended up at odds after her Senate confirmation over vaccine policies and other matters, given her belief in science and medical evidence and RFK Jr.'s long-established dedication to fringe, false conspiracy theories about vaccines. Manaras' lawyers say Kennedy and HHS are, quote, weaponizing public health for political gain. Here is what the White House press secretary, Caroline Leavitt, said this afternoon.
Her lawyer's statement made it abundantly clear themselves that she was not aligned with the president's mission to make America healthy again. And the secretary asked her to resign. She said she would, and then she said she wouldn't. So the president fired her, which he has every right to do.
There are still more CDC vacancies to address because in the midst of the ousting of Manaras, resignations rolled in from other top CDC officials. In other words, some of the main people responsible for your health, your children's health, your parents' health, and America's public health. Today, after being escorted out of the CDC building, 3 of these top CDC officials spoke to a crowd of supporters.
What makes CDC great are the people that make CDC up, the scientists, everyone that makes this a family, and it's a family that defends our country and the health of our children and the health of adults.
Let's get the politics out of public health. Yeah! Let's get back to the objectivity and let the science lead us, because that's how we get to the best decisions for public health.
We haven't been as effective because we've had staff cuts, program cuts, and then political interference.
And what about ACIP? Is that
so ACIP coming up is really one of the things that tipped us all. We are concerned about the upcoming recommendations that probably have been made before we have the data and the science.
So ACIP coming up is really one of the things that tipped us all, said Dr. Deborah Houry. ACIP is the vaccine panel that develops recommendations for vaccine use for Americans, which the CDC then uses to create official immunization schedules and recommendations. Now, ACIP, or the panel's upcoming meeting, is worrying, if not terrifying, lawmakers on both sides of the aisle, including Republican Senator Bill Cassidy of Louisiana, who worked as a physician before entering politics. Cassidy there, as you may recall, cast the deciding vote to confirm Kennedy as health secretary after receiving assurances directly from Kennedy that he would not dismantle the nation's vaccine safety systems and would not take down government vaccine guidance, and then he would consult with Dr. and Senator Cassidy before any major decision. But today, Senator Cassidy warned that a September meeting of Kennedy's vaccine panel should not even take place, saying, quote, serious allegations have been made about the meeting agenda, membership, and lack of scientific process. These decisions directly impact children's health, and the meeting should not occur until significant oversight has been conducted. If the meeting proceeds, any recommendations made should be rejected as lacking legitimacy, given the seriousness of the allegations and the current turmoil in CDC leadership, unquote. Now, the fact is that RFK Jr. for decades now says things that are not true to justify extreme positions and actions when it comes to public health. One such example just from today, when RFK Jr. tried to justify getting rid of all these health officials who have actual degrees in their fields of expertise, unlike RFK Jr.
The CDC is an agency that is very troubled for a very long time. The CDC has on its website today among the top 10 medical innovations, greatest medical accomplishments in history was abortion. This is one of the greatest medical accomplishments because it keeps small families. Go to the website, look at it.
Okay, so you know what? We went to the website. We looked at it. And the word abortion does not appear in either of the two places where the CDC lists the top 10 health accomplishments in history. HHS, when we asked what gives, the word abortion doesn't appear there, despite what RFK Jr. said. They pointed us to the mention of family planning and contraception as one of the top 10 achievements. And then they referred to us to a document going into more detail about that. But that document talked about the need to reduce unwanted pregnancies, family planning to avoid unwanted pregnancies, to avoid abortions. It did not cite abortions as one of the top 10 health achievements, and it was not saying abortion is part of family planning. Read the document, Secretary Kennedy. Again, a Kennedy construction built upon a foundation of mendacity. And this is just the latest example of Secretary Kennedy making rash decisions that could impact your health, basing these decisions, on complete and utter